Hi, my name is Michaela Nestman, and this is my video for Animal Nursing 3. My student ID number is 2882730. Enjoy. You want to go from the top of their mouth and then kind of quickly and efficiently put it on, and then snap it and then secure it. And you want to do that as safe and fast as possible. And for the user raised pull, we just want to flip it over their head and kind of tighten it like that and lock it in place. And this allows us to have good control over them and have them at a safe arm's distance so that we don't get bit by the mouth, and we can use the rabies pole to guide them where we want them to go. A restraint device technique that we can use is a towel wrap. And so we first want to lay the patient in sternal recumbency, and then we want to take one end of the towel and snugly wrap it around the patient, leaving the head out. And then we want to go ahead and wrap the other end. Tightly. And this allows access to the head and to the vein for blood draws. So when needing to place a urinary catheter in a male dog, you first want to wash the area with antiseptic solution or chlorhexidine solution. And then after you clean the area, you want to go ahead and have the doctor put on sterile gloves. And then with sterile gloves, you want to extrude and then gently insert the lubricated tip of the catheter in. And once you've reached the lumen of the bladder, then you want to take a sterile syringe and draw back a few cc's of urine. And then you want to discard that urine and then get a new syringe and draw back about 2 to 3 cc's of urine for your sample, or however much you need. So when doing a free catch sample, you want to make sure that you catch it midstream.
There goes.
And then you want to put it in the cup, and that's it. So when doing a cystocentesis, you first want to have the patient in either lateral recumbency or dorsal recumbency, and then you can use the aid of the ultrasound to locate the bladder. And using a 20 or a 22 gauge needle, 1 inch long. And you first want to make sure that you palpate the bladder first. Don't think so. Looks good. Looks good? Okay. And then directing the needle in, making sure that you don't redirect it, then draw back and make sure that you don't have the vacuum when you pull it out, and you're good. So when needing to express anal glands on a dog, you want to have your hands gloved, and then you want to lube your index finger on your dominant hand really well. And then it also helps to have a baby wipe ready in your other hand. and gently inserting your index finger into the butt to the first knuckle, and then about 7 o'clock and 4 o'clock and 5 o'clock are the glands, and you're just going to gently squeeze and roll between your thumb and your index finger, and you're going to do the same thing on the other side. So when you have a dog that needs their toenails trimmed, you want to first get the appropriate size clippers for them, and then you want to make sure that you have quick stop available just in case you quick them, and then you want to grab the toenail and then you want to clip with the direction of the toe. So you don't want the clippers perpendicular with the toe, you want them parallel, and you want to clip fast and easy to get through the nail and that you don't crush it, and you want to go until you see the start of the quick. And on dogs with clear nails, it's easier to tell because it's just that pink spot where the blood supply starts. And on dogs with dark nails, it's a little harder to tell, but you could tell mainly by the closer you get to the quick, you get this black circle in the middle of the nail that lets you know that you're getting really close. And then you kind of want to clip their nails at short different angles so that there is no sharp points on the nails. When clipping a cat's toenails, the first thing you want to make sure you have is the proper size nail clippers, or you could use the nail scissors like these. And then the big difference between a cat and a dog's nails is that cats can retract their claws. So you have to push out each claw, and because all cats have the clear nails, you could see they're quick, and you just want to snip quick and fast as high as you could go without hitting the quick. And you want to make sure you get the dew claw if they have dew claws. And that's it. So when you have a dog that needs to be pilled with medicine, you want to grasp them by the jaw and you want to shove the pill in the back of their throat. And then you want to hold their mouth closed gently and kind of rub on their throat to make sure they swallow. And if they don't swallow that way, you could gently blow in their nose to encourage them to swallow. So when you need to hand pill a cat, you want to grasp their upper jaws and kind of pull down on their bottom one and stick the pill in the back of their mouth and kind of rub their neck to help them swallow. And then with cats, to help them ensure that they've swallowed and to ease it down, you could use a syringe full of water to put in their mouth and kind of... Okay, so when you need to clean out ears on a canine, you first want to take...
I ordered this.
Can I do this here? Solution. And kind of put it all in there and kind of squish it around to loosen up the debris. And then because it is a canine and a large canine, we want to start off with our gauze squares and kind of use our fingers to just dig in there to start getting all of the bacteria and the debris out of here. And it helps to have some of the gauze squares soaked with this solution as well.
And then I put that one on and do the exact same thing. No. She says, you're definitely no. Yeah, he's been.
And then once you've got most of the big debris out of just the general ear canal, then you can use a cotton applicator to go in between the crevices and deep down into the ear.
But he was starting to come up. He will get up.
As you are doing it with the cotton tip applicator, you just want to roll it around on the skin, but you want to make sure that you don't do it too rough as to cause the ear to bleed. What? Yeah.
How do you bring that up when we're talking about our clinic history?
And then once the cotton tip applicators come back clean, then you can take a draw gauze sprayer and kind of dry the ear out.
Those dogs many times with the doctors, and I never had that. Because everybody.
And then you can switch to the other ear. So once again, we're going to dump some of the solution into the ear canal and kind of squish it around
Got one more.
to loosen up all of the debris. And then take a gauze square and use your finger to kind of dig in and wipe out the gunk.
That's it. Sit. No, sit.
Real life lesson.
And then you kind of want to let the ears dry for a little bit before applying medicine. So then after you've allowed the ears to dry, then you want to go ahead and apply the medicine.
You can grab him. We're good. I'm gonna call them on Saturday.
And you want to make sure that you get deep into the canal. That's as far as it goes.
Is that monitoring sheet still? Yes. You're a chunk.
Another trash can on that I thought so far.
Oh, I'm sorry.
Haven't been trained for at least. Pick up here, and then Cassie, they just like try
Stop,
to
Nora.
figure out
No.
whether it got changed or not, that it opening time.
Let's have a shiny one.
It's roasted.
Yeah, the one
We have that round trash cans with a lid on.
More?
Where we have the over expired.
And that's it. Clean or medicate a cat's ears. You always want to start with cleaning, and then you want to take the cleaning solution and kind of dribble it in their ear, fill it up, and then you want to squish it around to help loosen up the debris. And then after that, because their ear canal is smaller than dogs, you're mostly going to use cotton tip applicators, and you just kind of want to go in and you want to get all the crevices.
elephant. Okay, honey.
And then you want to do that until you get most of it out. And it's a clean ear. And then you could also use gauze squares to clean like the pinna and all of that henna. And then after you're done, you could dry it or use a dry gauze and use the tip of your finger to kind of go in there to make sure it's really clean.
Explain it to you on my own.
And then you would do the same thing for the other ear. And after you've cleaned the ears, you want to go ahead and put in the medication. And so you want to get the, what is it called? The dropper. You want to get the dropper
Okay, elephant.
in the ear canal as deep as possible without injuring the eardrum. And just put 1 or 2 drops in and then kind of squeeze the ear so that it gets all around. And that's it. So if you need to apply topical medications to a patient, a good thing to always do is wear gloves so that none of the medication absorbs it into you. And in this instance, we have a cat with a sore on her back right paw. And so we're just going to put on some antibiotic ointment. Put a dab on there, and then we can just rub it in with our finger. And that's it. And because of the location of where it's at, we don't want them to lick off the medication. So also it will help to put a Elizabethan collar on the patient so that they cannot look at the medicine. So when you have to do gastric intubation on a dog or a cat, for the technique you want to measure from their muzzle to their 8th rib approximately. And then you want to go ahead and have the patient in sternal recumbency. And then you want to gently insert. The tube. And then after you've inserted it to the predetermined length, then you will go ahead and administrate the medications needed that way. When needing to perform ocular diagnostic tests, you first want to start with your shimmer tear test, and you want to make sure that you keep the strip sterile so that it doesn't touch anything except the inner eyelid. So sometimes it helps if we bend the notch first. So to keep it sterile, you want to only grab the very edge of it. And then making sure that the other end, the notched end, doesn't touch anything other than their inner eye. And after a minute, you want to take it out and read it. And hers is at 6. So based on that, we know that she has very low tear protection because normal is about 15 or more millimeters. And 10 to 15 is kind of where it starts to be abnormal, and anything less than 10 is where we're concerned with dry eye. Tear test, you can then go ahead and do the tonometry test. And we first want to put on a new sleeve. And then we want to go ahead and turn it on. And when it's ready to read, it will have the 3 dashes on it. And then we want to press it to the center of the eye lightly, and it will chirp 6 times for the number of application it needs, and then on the final application it will allow a beep, beep. And so her reading is 17/95. And the last test that you want to do is the fluorescein staining to look for any scratches or ulcers that are in the eye. And so, so you want to start with the fluorescein stain, and you want to put 1 or 2 drops in the eye to cover it completely. Oh, don't start that. And then you kind of just want to squeeze the eyelid shut to kind of make sure that the stain is all the way around the eye. And then after you make sure it does that, then you want to go ahead and rinse the eye with just sterile eye wash. And it helps to have gauze at the ready under the eye just to soak it up. Good. And once you got most of the stain out that you can, you want to use a black light to look at it. And the black light will let us see any of the scratches or ulcers on the eyelid or the cornea. And I could see one tiny scratch on the eye, but other than that, the eye looks good. So when you need to administrate an enema, you need to prepare the enema with some water and then with some lube. And you want to make sure that the lube and the water get mixed.
That's okay.
So then after we prepared our enema, we could go ahead and get our tube ready. And we want to make sure that we put plenty of lube on the tube itself. Good, or should I sample? And then you want to gently insert it. And you kind of want to advance it about 8 to 10 centimeters. And then you want to get a
It's okay, just from sitting there.
syringe of the enema, and then you'll attach it to the tube, and then you'll slowly push the enema into the patient while you are also advancing to loosen up the stool. And that's it. When administrating sub-Q fluids, you first want to make sure you have a clean needle on your line, and then with someone restraining them, you're going to want to create a tent in the skin. And with the beveled side up, you want to quickly poke and then kind of shuffle the skin on the rest of the needle, and then you can start having the fluids flow. And when you're administrating fluids, you want to make sure that you don't do more than 100 milliliters per pocket so that it doesn't overstretch the skin. And then once you're done administrating the fluids, then you want to go ahead and stop the flow and then draw out the needle while at the same time pinching off the skin so that no fluids leak out. And that's it to administrating sub-Q fluids. So when you have a wound or a limb that you need to bandage up, you want to do a modified Robert Jones bandage. And you first want to place your stirrup . And then you want to go ahead and take your cast padding and start rolling from distal to proximal. And you want to layer it, overlap it about 50% of the next one. And you want to make sure that you don't cause any creases in the material, because creases will or can cause tissue damage.
Needs attention.
And then once you've done the cast padding layer, then you want to go ahead and do the string gauze layer, and same thing of distal to proximal, and you kind of want to use your thumb to tighten it as you wrap it. And once again, you want to overlap 50%. And then after you've placed your gauze layer, you want to go ahead and invert the stirrups back. And then you want to go ahead and place your vet wrap layer for the protective outer layer. And that's how you place a modified Robert Jones bandage. And then to remove the bandage, you can either unwrap it, so when putting a splint on a patient, you first want to start with your stirrups. And then after the stirrups, you want to go ahead and put on the cast padding layer. And then after you put the cast padding layer on, you want to go ahead and put on your gauze layer. And then after you put on the gauze layer, you want to reflect the stirrups back. And then after that, you can then go ahead and put on the split. And you want to make sure that the split goes to the elbow.
If necessary, and then he just
Okay, I'll put it in the safe for now.
And then you want to go ahead and secure the split with that wrap. And then to remove a splint, you want to start removing if you have an animal coming in with a wound on its abdomen, but you don't have time to really look at it or clean it, then you want to go ahead and apply a pressure bandage. And with a pressure bandage, all you're really doing is putting a dressing on the stomach, and then you are wrapping the abdomen with cast padding.
Yeah, I don't
And then after that, then you're going to just apply a protective layer of wet wrap. Making sure that you apply enough pressure to hold it in place. And that's it for a pressure bandage. And then so when you have a dog or a patient come in for an emergency, you very first want to perform basic triage. And that includes making sure that you check their airways to make sure nothing is blocking their throat, that they are able to breathe. And then you want to check their heart rate. And then you want to check their capillary refill time. You're okay. And that is under 2 seconds. And then you want to go ahead and check their external injury assessment status. So you just want to look them all over from head to toe to see if you can find any wounds or any signs of bleeding or trauma to the animal. And you want to check their paws. And then after all of that, you want to check their mentation to see if they are present with us or if they have something going on with their brain. And everything looks good on that front. And so that's it with basic triage. So if a patient has a laceration, to perform first aid on it, you first want to apply.
No, that was Jasper's.
Lube.
Shawnee.
On the laceration. And then you want to go ahead and shave the hair around and over the laceration, and the lube helps to catch the hair so that it doesn't fall in. And then after you've shaved around the last, of the extent of the laceration, then you want to go ahead and irrigate and clean the wound. And then so then after you've irrigated it, you kind of want to dry off the area with some gauze. And then once that is done, you can then go ahead and apply medication if needed. And then we want to go ahead and bandage it up. And for bandaging a laceration, you want to have a non-adherent dressing that you want to place on the wound. And then you want to get some cast padding. And then you kind of just want to watch the bandage to make sure that there's no breakthrough bleeding that you need to be aware of. And you want to keep the bandage as dry and clean as possible until the next bandage change. And it depends on the severity of the wound, of how frequent that occurs and how soon that occurs. And that's it. So when doing a dental, you first want to do a preliminary assessment of the teeth to see how much tartar or plaque or gum disease is there. And on this patient, there isn't that much buildup on the teeth. There is a little bit of gum recession, and then a little bit of abrasions and wear on the teeth. And after our preliminary assessment, we want to go ahead and do a manual prophy techniques to try to get all of the big stuff off. Gotten all of most of the stuff that we can with the manual technique, then we want to go ahead and do the ultrasonic scaling. Oh my God. And with the ultrasonic scaling, you want to just make sure that you get under the gums and kind of gently use the side of it to scrape off what's on the tooth. And then after you've scaled the teeth, you want to go ahead and polish. Making sure on the polisher you don't press too hard or go too fast so as not to cause friction. And once again, you want to make sure you get all of the tooth surfaces that you can have access to. And then after polishing, we want to give it a rinse. And then after rinsing, we want to go ahead and do our fluoride treatment. And with the fluoride treatment, you just want to go ahead and gently rub it on the teeth surfaces. And you want to let it sit on the teeth for approximately 60 seconds. And then after it's been on there for roughly a minute, you want to go ahead and gently wipe it off. And you're pretty much just wiping off the excess. And the fluoride treatment helps to prevent further buildup. And then you want to make sure that the patient doesn't come into contact with water for 30 minutes afterwards to make sure that it has time to work. And that's it for dental. So, when advising a client about home dental care, we really want to stress the fact that brushing their teeth is very important at home. Just like us, they need their teeth brushed every day. Preferably with a doggy toothbrush or a cat toothbrush with the appropriate toothpaste. But if they won't handle the brush, then you could simply start using the tip of your finger. It's all about just making sure that you're agitating the particles that could sit on the teeth and stay on the teeth and lead up to building up to tartar or plaque. Besides brushing, we could advise that their diet consists of hard kibble instead of wet food, because the kibble will help move around their teeth and to kind of brush against their teeth to hit those and to keep the particles from settling on their teeth. Wet food isn't preferred. On top of brushing and diet, we could advise the client for care at home that it helps to put some oral rinse into their water so that when they're drinking the water, it goes in their mouth and helps with the teeth that way. Or we could advise that to get certain toys for their animal that helps their teeth go in grooves and on bumps or ridges, just to make sure, just to once again aid in the agitation of the particles, so that the food particles don't have a chance to just sit on the teeth and start building up.